You've heard about estrogen, progesterone, and testosterone, but you may not know about DHEA. This overlooked hormone might be your key to better energy, skin, libido, and longevity. So, in today's episode, I'm going to explain what it is, why it begins to drop in our 30s and 40s, and how to know if supplementing it might be right for you. Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristin Jackson. Every week, I share my over 25 years experience to guide both men and women as they age. Listen as I discuss a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. It's happening to all of us, so listen for some solid scientific knowledge on how to handle these changes. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. You know, I love talking about hormones, and DHEA is just another hormone, but it doesn't get as much of the fanfare as estrogen and testosterone gets. DHEA stands for dihydroepiandrosterone, but that's a mouthful, so that's why we call it DHEA. And there are actually two forms, DHEA and DHEAS, or the sulfated version. DHEAS is made 100% from our adrenal glands, but DHEA comes mostly from our adrenal glands, but it can also come from the ovary and even the gut. Now, why do we need two forms of this hormone? Well, DHEAS circulates through the body, but is unable to cross into the blood-brain barrier, so it can't get to the brain, whereas DHEA has effects both in the body and can cross the blood-brain barrier, so it does also have effects in our brain. DHEA is often thought of as a precursor hormone because our body converts it into both estrogen and testosterone as we need it. And just like many of the hormones in our body, our levels of DHEA peak in our 20s and then begin to fall in our 30s and 40s and beyond. So because the majority of DHEA and 100% of DHEAS is made in the adrenal gland, if you measure these levels, they're really a marker of your adrenal function. So when your adrenal is functioning well, you should have good levels of DHEA. And when your adrenal is not functioning as well, your DHEA levels fall. We can also see the opposite happen where your DHEA levels are excessively elevated. Those are in conditions like PCOS is probably the most common, but also congenital adrenal hyperplasia and Cushing's disorder. So those are patients who have excess adrenal hormone because they have hypertrophy or overgrowth of certain levels of the adrenal gland that make more of the DHEAS and DHEA. So what does DHEA do? Why do we need it? Well, as I said, it is a precursor hormone and it can be converted into both estrogen and testosterone when we need it, but that conversion is not exact. Meaning I can't give you DHEA and reliably know how much your body is going to convert into estrogen and how much it's going to convert into testosterone. So if I am treating you and I feel that you are low in either estrogen or testosterone or both, I'd rather just replace those hormones directly because then I know exactly what you're getting. But DHEA has its own positive effects in the body. It stimulates our osteoblasts. Those are the cells that help to grow our bone. It stimulates the production of muscle, so that helps us to grow and maintain our muscle mass. It supports our mitochondria, which helps us to burn glucose properly and burn fat. Those are the energy organelles in our cells. DHEA has also been shown to lower pro-inflammatory cytokines, and it increases things like natural killer cells and T lymphocytes, so it's stimulating our immune system to work better. DHEA in the brain, remember that's the one that can cross the blood-brain barrier, can also promote more GABA release. And GABA is a neurotransmitter that makes us calmer and reduces anxiety. I am always trying to stimulate patients to make more GABA because we could all use improved calmness and less anxiety in our lives. So, because DHEA is a prohormone, and for many years it was thought that it had no function of its own other than to be converted into estrogen and testosterone, it's considered a supplement. And you can buy it online or over the counter. It comes in creams, it comes in pills. But I will tell you, you want to be cautious if you are going to supplement on your own. So you may be thinking, boy, DHEA sounds great. It might be an easy way for me to supplement and increase my bone mass, increase my muscle mass, decrease my inflammation in the body, and stimulate some of my hormones that I need. And those things are all correct. But if you are going to supplement, I think it's best that you measure first and only supplement if needed. So in women, if you test your DHEAS levels, we generally measure DHEAS rather than DHEA. It's just not as well studied, so we have more data on DHEAS. Measure your DHEAS levels, and they should be about around 100. That's a reasonable level. Some patients, we can actually supplement them up to 200. That's fine. But if you are feeling symptoms of low libido and fatigue and increased belly fat and decreased muscle mass, and your DHEA level is well below 100, then you may be a good candidate for supplementation. So I think measuring with levels is really important first, because I think too many of us just throw supplements at ourselves without actually knowing if they're doing any good. And once you start supplementation, you want to supplement the level to get it up to at least 100. Now, if you're under a qualified physician's care, you may also continue to supplement and get that level even higher to 150 or even 200, but I do that under cautious supervision. So, how do you supplement it? Well, as I said, you can find it over the counter in pills and in creams. Now, cream forms I'm always concerned about simply because you really don't know how well your body is absorbing the cream. And it's been proven that from one person to the next, our absorption of anything through a cream is very variable. So, one person may absorb the DHEA really well through their skin, and the next person may not absorb it quite as well. Obviously, you can monitor this by monitoring your DHEAS levels in your blood. The over-the-counter pills also, because they're not regulated by the FDA, can have a variable amount of DHEA from one pill bottle to the next, or even one pill to the next. It's really beholden to each individual supplement company to talk about the quality and consistency of their product. So, because of this variability with creams and because of this variability in the potential dosing with over the counter tablets, if I'm going to supplement DHEA, I generally recommend that we do it through a compounding pharmacy. Compounding pharmacies will dose the DHEA correctly, and I will know that at least what I'm giving you is exactly what I want you to have. There won't be that variability that there will be with over the counter products. If you're starting with compounded DHEA, now you know your product is pure. There's no other fillers or added ingredients. So we typically can also start with lower dosages. If I'm supplementing for a woman, I'll usually start with 10 milligrams compounded DHEA. For men, I'll typically start with 20 milligrams compounded because men need to have a higher level anyway. If you want to supplement with over-the-counter supplements, I usually recommend that you double those numbers, simply because, again, we can't count on the consistency of that product. So if your over-the-counter product says 10 milligrams and there's variability to the low side, you're not even getting your dose. But if you're dosing it over-the-counter doses of 20 milligrams, I'm hoping to kind of take out that variability. And once again, once you start supplementing, it's always a good idea to follow your levels. If you've heard me talk before, you've heard me say that all reference ranges for any level that we have on a lab value, there's a reference range and it's a bell-shaped curve. So it gives you the low range of normal and the high range of normal. And for optimal DHEA levels, we want our patients to be on the right side of the bell curve in the high range of normal. So for women, that's going to be above 100, maybe even up to 200 or 250 under careful monitoring. For men, they're going to want to be up closer over 200, maybe up to 300 or 350 for optimal results. Another neat benefit of supplementing your DHEA is that DHEA levels and cortisol, or our stress hormone levels, are inversely related. So high cortisol levels are associated with increased belly fat, that increased visceral fat, and high cortisol levels suppress our DHEA, This might be one of the reasons why our DHEA goes down as we age, because we get more stressed. But supplementing with DHEA helps to reduce cortisol levels, and it's thought that this is one of the mechanisms by which DHEA reduces that belly fat. So it may reduce cortisol levels, reducing your stress, reducing your belly fat, your visceral fat, and of course, making you feel better overall. Now, there is one pharmaceutical product containing DHEA, and it's FDA approved for the use in women in the vagina. It's marketed under the name Intrarosa, and it's a small suppository, vaginal suppository that you place inside the vagina every night. As you place that vaginal DHEA, the vaginal cells are going to absorb it, but inside the vaginal cells, they're going to convert it to both estrogen and testosterone. And Intrarosa is indicated for treatment of the dry, painful vagina and pain with intercourse. And it works very, very well. A lot of our patients like to use Intrarosa if for whatever reason they don't want to use vaginal estrogen, which is also a fabulous product for that. But Intrarosa contains 6.5 milligrams of DHEA. You can also have your physician compound vaginal suppositories. You can compound them up to 10 milligrams of DHEA and place those vaginally. Or if you don't like the vaginal suppository route, because once you put the suppository in, your body heat will melt it. That helps it to absorb. But sometimes the next morning it's a little bit messy. So you can have your physician compound DHEA in a cream that you put on vaginally, and you can massage the cream into the vaginal opening and the bladder opening, and it will absorb a little bit better. It takes away some of the mess factor. So you can get that both as a pharmaceutical product, Intrarosa, that's a great product, or you can compound it. Ask your physician to compound it for you. So then we get down to, are there any side effects? Can you just take this? It is over the counter, but are you going to experience any side effects from supplementing DHEA? The one big question about it is, does it cause hair loss? So let's think about that. DHEA has to get converted into both estrogen and testosterone in all patients is further converted into DHT. There's an enzyme called 5-alpha reductase that does that. For some men and women, they have a really active 5-alpha reductase enzyme, which means a lot of the testosterone gets converted into DHT. And unfortunately, DHT is toxic to the hair follicles. So as we raise DHEA levels, if you happen to be a patient who has a really active 5-alpha reductase enzyme, you may start to notice some hair loss. But I'll give you a caveat about this. You're not going to start DHEA and notice hair loss within the same week or even several months after starting it. Because as DHEA levels go up, if they eventually get turned into DHT, that's the toxic hair follicle hormone, that's going to take many, many months, because that DHT is going to make the hair follicle smaller and smaller and smaller, and eventually it's going to grow over itself. That process is actually called miniaturization of the hair follicle, and the hair can no longer grow out from it. That's what happens with male pattern baldness or androgenic alopecia. It's a slowly developing condition over many, many months and years. If you start any hormone product or any supplement and you see rapid hair loss, hormones don't work that way for rapid hair loss. Rapid hair loss is called telogen effluvium. And that can occur when we have stressors in our lives, when we have illness, or when we have a rapid hormone change like pregnancy and postpartum. Lots of women may remember after having a baby, you suddenly have this hair shedding where it's just coming out in clumps. I promise you, telogen effluvium does not leave you bald. It is a temporary situation where all the hair follicles reset to the same growth cycle. So they all fall out at the same time, and then they all start regrowing at the same time, but it does not cause baldness. So the miniaturization of the hair follicle that I previously described does not occur in telogen effluvium. But DHEA doesn't cause telogen effluvium. It potentially can cause that androgenic alopecia or male pattern baldness over time, but it's not something that happens very quickly. So if you are noticing rapid hair loss, look to what else is going on, what stressors are in your lives, what illnesses are in your lives, what very drastic hormone changes are in your lives, i.e. pregnancy, to look for those changes to telogen effluvium. So if you feel like you've been doing everything right, you're supplementing your hormones, maybe you're on a hormone replacement therapy, and you still feel like there are some symptoms that your hormone replacement is just not addressing, maybe DHEA is your missing piece. I think it's always best to start with a qualified physician, start with measurement so we have objective information and we actually know if low DHEA is responsible for your symptoms. But if it is, it's an easy supplementation to fill in that gap for maybe what your hormone replacement may not be doing. As always, I love speaking with you about this, and I'll talk to you next time. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.